Ladies and gentlemen, obviously there's some great things in this amendment, which I rise in strong support of. It does help reduce some of the taxes on the middle class, which we talk about a lot. I think it really does honor veterans, as we knew there were some major cuts, to their last rites. But I also, like my colleague, I want to mention something about the hospitals, but not so much about the hospitals, but I'd like to talk for a minute about the patients. There's this notion along the way that somehow we can control costs by controlling reimbursement. And that somehow we can control costs by cutting taxes, levying taxes on the institutions. And somehow that's supposed to what? Pass through to the patient. They can't pass through to the patient. And for instance, in the surgery center part in here, if you put taxes on the surgery center, there's nowhere to pass those costs through because reimbursements are either fixed or we turn around and slash them. So there's nowhere to go for the hospital. They're not going out of state. I guess that's the good news. We've heard a lot about people going out of state. But the problem is they can't do anything with it. We got them in a corner. So what happens? What happens when that happens? The institutions now have a hard time keeping programs afloat. If you want the institutions to be the hospitals to go out in the community and have programs that increase the health and welfare of our community, they can no longer do it. Because they're not able to hire that extra nurse practitioner. They're not able to hire that extra PA. Because we've slashed them and we've backed them into a corner. So at the end of the day, it's our constituents and our patients that suffer, not the hospitals. Folks in the hospitals, yeah, we're going to lose some jobs, no question about it. In Western Connecticut health system, we're going to lose jobs because of this bill. They've told us it's happening, and other places around here, the smaller hospitals, Stanford, Stanford's trying to build a new hospital. You think they'll be able to do that now? We keep doing this? So the bottom line is, we got to stop hammering them. And I don't know what it is about this session this year, but it's been particularly ugly. And I think it's just I think we have to stand back and think about it for a second. I think it's just a lack of understanding at what the institutions go through. It's not just a normal business. Their reimbursements are controlled, as I've said. We turn around and slash them. We got them in a corner. What else can they do? They're not going to be able to pay any attention to the quality of health care in our community. So the next time the surgery center is a great thing. I'm walking down the stairs the other day, and I'm realizing that my knees are starting to make noise. And I'm thinking to myself, my God, if I have to go to one of these surgery centers in 10 years, what's it going to look like for me? I just had my arm done, but I've been told now that we've levied this new tax on the surgery centers. They're in the same boat the hospitals are. So I'm wondering, am I going to have the same surgery center right down the street? Or am I going to have to go to an institution and do it? See, these are real life things that happen to our constituents. And that's what we got to be thinking about here, folks. And I don't think we're giving it the thought it deserves. This is a very simple amendment to give those institutions and those surgery centers some relief. We got the money here to do it. This is one small step, and it's going to affect all our constituents. I urge the support of this amendment. Thank you.